Once again, good morning, everyone, and welcome to the coffee chat with the superintendent. My name is Rich Arkanoff, your superintendent, and I'm blessed and honored to serve all of you. Thank you very much for that opportunity. With me today is Stacy Conrad, our Executive Director of Communications, Assistant Superintendent of Teaching and Learning, Nora Hoover, and Assistant Superintendent of Human Resources, Health Services, Jason Taylor. And so we're going to present to you today some information as we get ready to head back to school this year and where we are as of today on our back to school plan. And I will share that this could change and most likely will have more changes as we move towards the year. It could also change during the year based on everything that's happening. With last year, I think that's the one thing we all learned. The one constant in the universe is change, and we are doing our best to all adapt to it. And I want to thank all of you for your efforts to be flexible and provide grace as we continue to adjust to the needs of what we have to do to support our staff and students during the pandemic. So thank you. So the first thing we'll talk about today is our back to school plan. And just to give you just a kind of a little bit of good news here, we're seeing our vaccination rates in our community are doing pretty well. This is probably a couple of weeks old now, but or was this July 19th? I guess it wasn't that old. So but you can see where our rate is moving up, and particularly Bargersville looks pretty good at almost 72%. So it looks like that's going well in our community. I want to remind everyone that during the presentation today, please use the Q&A box to ask your questions. Stacy will monitor those, and she will help facilitate the questions throughout the presentation. We did receive some questions ahead of time, and we'll also answer those at the appropriate time. So as you can see, our vaccination rates are doing well and hopefully continue to increase. So the big question for everyone is masks and face coverings for this upcoming school year. We've made that an option here in our district. We know that various organizations have recommended that masks be required. We have worked with the Johnson County Health Department, and in our community, we feel that by making the masks optional, we are providing those that are comfortable wearing masks the opportunity to wear masks, and we hope they will. And those that are uncomfortable wearing masks, and honestly, there are a lot of folks that have maybe some issues with wearing masks, this will provide them the opportunity to not have to wear masks. So there's our first big question. I know we had a question, Stacy, on mask wearing. You want to go ahead and ask that question now? That was in ahead of time, remember? Oops.
Yes, that person was asking about why will masks be optional based on what the CDC recommendations are for unvaccinated people, knowing that the elementary school students are not eligible for vaccines yet.
Correct. Yes, and that actually that's a great question. I appreciate that one. It does come a lot off of working directly with our local health department, and they get a lot of recommendations from different organizations. I believe the American Pediatrics Association has also recommended that. And so while we work with the local health department, and they've given us the ability to make that an option for our staff and students, we felt like that would meet everyone's needs. until it became something of a mandate from as it was last year, if you remember. Jason, would you like to add anything to that?
No, I think that's well said. That's something that's going to be consistent with the schools in Johnson County. It's something we met with the county health department as a group and decided that keeping the mask optional, or even if, using those words recommended at times, is out there. That seemed to fit the need of the community at large.
Yeah. So the situations where face coverings may be required, as you can see on this slide, is if you're identified as a close contact and who are quarantined and will need to wear a face mask for between 8 and 11 days following their exposure. This helps bring students back to school quicker. And then, of course, in our clinics, you'll be required to wear masks at all times. Next is social distancing. What are we doing about that? Well, we're really fortunate we're going to be able to use the 3-foot rule. That's been the recommendation. So we'll be able to do that in our elementary schools. Cafeterias are going to get back to pretty close to a normal seating. If you look at the measurements nose to nose across a cafeteria table, in most places that is 3 feet. Your round tables are a little bit different, so they'll come up with some creative seating there for the round tables. Recess will return to normal and field trips will resume. When students go on field trips, however, if they're going to a specific place that has a more stringent mask rule, that will apply. Area schools, again, same thing, seating is 3 feet. And then during increased activity where exhalation occurs, so in other words, singing would be one. Band might also play into that. We do increase that to a 6-foot rule. So a lot of ECAs will return to normal as well. And of course, the field trips will resume as well. Any particular questions, Stacy, on the social distancing?
No, I think we had another one regarding symptoms. If kids are symptomatic, like with coughing, sneezing, those kinds of things that we think are similar to COVID, what is the guidance for them? I think Jason was going to take that one.
Yeah, I can take that one, Stacey. Thanks. The default guidance is that if you have COVID-like symptoms, you should isolate for 10 days. Now, we know that some of those COVID symptoms can easily present themselves and be something totally different. And we accommodated that last school year by allowing an alternative diagnosis from your medical provider, a negative COVID test also on certain days we qualify. I think that's something where it's true of any sickness that we may have, especially as we're approaching what could be a very strong flu season. That this year we want to make sure folks, if your kids aren't feeling well at home, let's keep them home today. Let's make sure that they're safe and not spreading any disease, whether it be COVID or some other virus. And if you can seek an alternative diagnosis, we'd accept that and allow the student to come back. It's also something to reach out and talk to the school nurse about and have a little dialogue on what the symptoms are and if that really is presenting COVID-like or if it's clearly something else.
Thanks, Jason. So next is about positive cases and contact tracing. A little bit on to what Jason had shared there. Individuals will need to stay home for 10 days following the onset of symptoms or positive test results, and parents should contact the school, obviously. And then contact tracing will take place for every positive case in Center Grove, and parents will be notified via an email and the Parent Square. So make sure you sign up for Parent Square if you haven't done that, and you can get it in multiple ways, text messages and emails. And also another side note about Parent Square, if you don't like it filling up your personal inbox, you can leave it all the information in the Parent Square app, and then you can just use the app to monitor your school email. So it might help you if you're like me and you have hundreds of emails in your inbox. And then, like I said, you'll be notified if you're a close contact, if your child's a close contact, and then you may choose to quarantine your students. So you may be quarantined, but you also, if you aren't quarantined, if your child's not quarantined, you can you can choose to. You can say, well, I understand, you don't think he or she was close enough, but I want to quarantine them. So that's something that you can do as well. Did I say that right, guys? Okay. And so we're still waiting on the DOE, I believe, on how these absences will be recorded for this upcoming school year. They probably will be similar to last year.
Rich, I just add,
Okay.
we're using the email
Yeah.
on the Parent Square to get the message out quicker this year, and to not do a phone call for every single quarantine. There will be a number included in that message that folks can reach back out to our staff. And if they have questions, we want to answer those. We just know a lot of times folks just want the dates and the key details of the quarantine. And so this will get that information out much faster.
Yes, thank you.
Sometimes we were not able to keep up with social media.
So quarantining guidance comes from the Indiana Code, and so all identified as a close contact must be quarantined from school. That's something that we're being required to follow. So a lot of folks asking us, why are you doing this? And here's the reason why. And a close contact as an individual is within 3 feet. So you can see that definition, and for at least 15 minutes. Regardless if they're wearing a mask. Now, I will tell you that while we do go out there and look at the distance, we're not looking, down to we will give a little grace on the measurement, if you will. The quarantine length is for 10 days following the exposure, and you can see the rest about activities and so forth. So, any questions about the quarantining guidance? I'll just kind of go into the next one. Hopefully that'll answer some of those as well. So returning from quarantine, as you can see here, on day 8, there's no symptoms, negative tests and so forth, and you agree to the enhanced precautions. You can, and you agree to the enhanced precautions, you can come back on day 8. And then for the enhanced precautions, you have for 11 days, you have no symptoms, 11 days or later past exposure, and no test is needed, no enhanced precautions are needed. So in other words, if you're coming in on day 8, you'll follow the things down at the bottom of the slide, which is to wear a mask for the next 3 days. And you'll maintain at least a 3-foot distance from others. And then during lunch, you'll eat separately from others, and remain about 6 feet from others as much as possible. Symptom monitoring by parents if needed by the school during the day. So anything else to add to that? Jason, no? Good?
No, you did a great job there. We assume day 11 will be what a lot of people will take, but we did really want to work towards that day 8 option. And that's something that our other county schools are not doing at the moment. They're working on it as well, but something our team felt pretty passionate about, trying to get out there for our students.
Yeah. Thanks. Jason's on the road, so I'm doing the presentation. I'm sorry, I am the B team. He does a much better job.
Oh, you're doing a great job.
So visitors to our school. Visitors will be allowed for school events outside of the school day. Volunteers will need to wear masks, should wear masks while they're in the building, and volunteers may provide proof of vaccination or an independent positive COVID test within the prior 6 months to be excluded from wearing a mask. So if you need to, if you'd like to volunteer and don't want to wear a mask, you need to do those things. And then lunchtime visitors will not be allowed in the elementary schools due to just the social distancing piece. We still need that space. If we add extra bodies in there, obviously it takes away from the amount of space we can spread out. So until we're able to close down that 3-foot radius, we'll probably will not be having elementary visitors at lunchtime. Building rental will resume. So if we have some organizations that utilize different parts of our buildings, they rent them, and so we will allow them. Those visitors should either be vaccinated and or wear a mask while in the building. And so we know we have some organizations. I believe we still have a church renting Sugar Grove, so they'll be allowed to rent that again. Continued focus on hygiene and cleaning. The same old story, right? Wash your hands before and after meals and snacks, and before and after recess. Just really just emphasize this big time with your kids about how important it is to continue to wash and use hand sanitizer when available. Our cleaning team, is continuing to work hard on those high touch areas. They'll continue to clean and sanitize more frequently like they did last year. I will tell you, I've been super impressed with our buildings, and if you've been in, they are the cleanest they've ever been. We have continued to improve our air filtration system. This has been going on for several years, and it looks like Dr. Long has joined us here, just got in. But that is something he has been working on over the last several years in improving our air filtration system. And recently we put in new system that cleans the air even better. And I don't know, Bill, if you're able to kind of maybe explain a little bit about that for folks. I know I'm assuming you're driving or something, but hopefully you can hear me. Oh,
Yeah, sorry.
there he
Yeah,
is. Yeah.
we're using UV lighting. It's a newer system. We have some in some buildings where we pull it's in the ceiling, but most of the units now, when we provide fresh air, we pull out the air from the classrooms. It's treated through the system, through the UV system, and then returned. So feel really confident and really happy to have that system. And we're in the process of adding that to Pleasant Grove and Sugar Grove as we do the renovations there.
Yeah, so it's really, really exciting. And a lot of the money that we were provided from the federal government has been used to enhance that filtration system. So we're able to do that again without raising taxes. The bottle fillers are available in every building, so that's the drinking fountains. So students can bring their bottles and fill their water there. Are we opening up the drinking fountains, guys? I couldn't remember that one. Or are we just doing bottles? We're going back to opening up drinking fountains.
It is allowed, Rich. We're still looking at how much of a
Yeah.
need there is for that to happen, but we will as we have folks that
Yeah.
want to use those.
Okay. Yeah, that's what I thought. Okay. So this is just a summary sheet of our recommendations that, masks will be optional under most circumstances. Elementary classrooms will continue to use pods, and secondary classrooms will return to normal seating with a 3-foot distance where possible. Social distancing to the extent possible, at least 6 feet in all areas of the school. An individual shall stay home for 10 days following the onset of symptoms or a positive test result. Regardless of mask wearing, only individuals identified by the school corporation to be within 3 feet of a person diagnosed with COVID-19 for a total of 15 minutes or more over a 24-hour period will need to be quarantined if not vaccinated. I hope everyone remembers that. That's pretty much the same thing that we've done all of last year, but just to clarify, that's 3 feet for 15 minutes within that 24-hour period. So if it's 10 minutes here and 5 minutes there, it adds up to that total of 15 minutes. And then asymptomatic close contacts may return on day 8 with specific negative testing and precautions, or on day 11 without testing or precautions. So what questions do we have here? Oh, sorry, I had one more. Again, we'll monitor COVID-related absences, and we'll continue to post those as we have. Just our numbers, because we know people want to keep track of that and looking at how that's control of the spread. We'll maintain the COVID dashboard online. You guys hopefully can see that, but you can go to www.centergrove.k12.in.us/COVID-19, and you'll be able to get all of that information. And we'll work with the Johnson County Health Department as we have, and we work with the other school districts in the county as well. But we're working with Johnson County Health Department to offer a rapid testing option on site. Have we gotten any update on that yet, Jason?
We do not.
Okay.
We're still waiting on that.
So we're still waiting on that. Okay. So we're hoping to have that. That would be something we would offer in our clinics, I believe. Yep. So one of the questions too is throughout the year, so forth, the changes that might have to occur if we see a spike in cases. We're watching what's going on with the newest variant, the Delta variant, and all of that. I've been given authority by the school board to make adjustments as long as I have consultation with the school board and the corporation administrators. My team will. So basically what that means is if we have to make a change in something, we can make that change without necessarily reconvening a board meeting. I can make that change, and then we can come back later and get board approval on it. Those may be based on an increase or a decrease in the spread in the corporation or the community, and they also may be due to new requirements, as you can see. And so just in the case that might happen, if for some reason the state or federal government increases the requirements and we have to change our plan and make it more strict, then that's what will happen. So I just want to thank Jason and Bill. Both their teams have done just an excellent job in this area. Amy Norman, who's the head of our health services, continues to do a great job. Our nurses are all working really hard to do everything they can to keep our kids in school, but doing it safely, and they're working hard. And I appreciate everyone that when you talk with them and you understand that they are doing everything they can in the best interest of your child, and we appreciate them so much. So I hope you make sure when you talk to them, you let them know how much you appreciate them, because it's a hard job calling parents and telling parents what might have to take place, whether you get in quarantine or not. With that, is there any other questions that we need to go through, Stacy?
Yeah, there are a lot of questions about whether the mask mandate is a requirement or a recommendation. Can you you or Jason speak to how we did do a lot of kind of digging in to try to determine if it is going to be a mandated thing or not?
Yeah, and I'd say it's been left at that recommendation stage, Stacy. That's a good kind of a dichotomy to draw there. Last year it was definitely a requirement. This year they've even clarified through multiple webinars from the Department of Health that is a recommendation, and our county has even made it a little bit different than what the state has done it based off the community spread in our county, which has allowed us to use even the word optional.
The next question I think that multiple people have had that's pretty good one is if they do have a student who's vaccinated, obviously the 12 and above age group, or someone who's had an antibody test or COVID in the last 6 months, what do they need to do to get that information to us so that they don't get quarantined?
Yeah. So some of the vaccination records are stored in the state database, and only our school nurse has access to that. But she can see, just like she would check on other vaccination status, students' vaccination status for COVID-19. And so for some individuals, we won't close contact and quarantine them because we will know that they've had their full dose of the COVID vaccine. We'll inform them that they were a close contact, that they won't be quarantined. as we do talk about notifying close contacts, that's where the instructions will come on how, if you've got proof that we don't have in our systems, if it is something like an antibody test that we don't have access to, that you can provide that to us, and the student can come to school the next day. So that will all be shared very clearly in those instructions when you are contact traced and if a student is quarantined.
And then one of the
I just want to be I want to follow up real quick. I just want to be clear. We're not keeping a master list of all this. We're not storing that data. That's something that is private, and we'd like the individual to only provide that when they're comfortable with it.
Another question for Nora was asking about, do they move to virtual learning if they do end up on quarantine for that 8 or 10 days? Nora, you want to talk through that?
Yes. This year, we are not having a virtual school per se, like we did last year, where students only attended virtually. But we would trigger for quarantine students the same things that we did last year when students were gone. In the elementary schools, the families and students work with their teachers to see what work can be made up. And they triggered, sometimes it was on Canvas, they would go on and get their work and lessons. Sometimes there was things that families could pick up or have delivered from the school if they were paperback or tangible resources. And so the families just work with the elementary schools. Very similarly at the secondary schools, that the students will work through Canvas a lot to get their assignments and then make contact with their teachers, just like they were if they were absent. We know it's longer, and our teachers did a really great job last year of trying to keep students caught up, and then not finishing that support until they were back in school and they could, use the other things within the school day to finish getting them caught up once they could come back to school. But we will be using Canvas a lot. And a lot of communication will be needed between the families and the students and the teachers.
Stacey, are there other questions?
Yeah, I think Jason was going to take one related to buses.
Yeah, so buses have been quite an interesting topic because, as we say, mask, but it's a recommendation that masks be optional in our schools. On the buses, there is a mandate from the TSA that applies to all public transportation, and the CDC has also included school buses on that. And after working and talking really with our county health officials, they want to make sure we inform parents that there is a federal mandate for that. But they've given us that they've understood that that's very difficult for our bus drivers to enforce. They need to be focused on the road. They need to be focused on other safety elements for our students to get them safely to and from school. And then, most importantly, I think that the argument on the bus that's really a tough one is a lot of our buses run with their windows down, especially during these hot months. Our students are on the buses for 15 minutes most of the time. We don't have really long bus routes, but then we're going to have those students come into a classroom and sit next to a kid where it's a recommendation or optional on the mask. So to have it required on the bus is really counterintuitive to the experience the student's going to have the majority of their learning day. And so for us, we're going to make some masks available. If a student would like one and they forgot one, we'll give that to them. We're going to inform folks that it is a mandate for the school buses, but it's not something that we're going to ask our bus drivers to enforce this school year. We do expect that will be something that will change early in the year. That a lot of schools are really struggling with the bus mandate, and we think hopefully the CDC and TSA will understand that really that's not where the spread's happening with this virus, and that's really counterintuitive to the other protections we have in place.
We had some other questions asking about staff vaccinations and if those are required.
Okay, they're not required. That's just an option for staff. Jason, is there anything to elaborate on that? I think that's really pretty much it, though.
That's true. Yep, sure.
Mm-hmm. Are there any other questions, Stacey?
I think we've covered most of them during some of these previous answers.
Okay, great. Well, as always, you can email us You can email myself, you can email Stacy, you can also email Mr. Taylor if you have specific questions regarding that. Anything academic related to that, you can definitely email your principal and or Mrs. Hoover. And of course, your principals can answer a lot of these questions as well. They've become very versed in this practice and our back to school plan, so I'm sure they'll be able to answer a lot of questions as well. And for some of you, that might be an easier way. You may be more connected to your principal to have those conversations. Okay, I think if we don't have anything else on that, our next topic we want to talk about is tonight, our parent information session, which we'll be talking about social emotional learning. And Mrs. Hoover, or Dr. Hoover, I'm sorry, is going to provide you with some information on that. So, Nora?
Yes. So we presented at the school board meeting last night, but we also know there are some more questions. And so we have collected in the questions we could have gotten as of yesterday morning, and we've added those. So we'll abbreviate our presentation from last week board meeting, but then we will share specific answers to the questions that were submitted by our parents. And then there'll be time for some small group. We'd like to get some feedback. So we have 4 questions we're going to ask at tables and take notes, because we want to collect all that information and be able to process it and continue to provide more answers. One of those questions, of course, what questions do you still have? And so we will take those questions that are newly generated questions and add those to our question and answers, and all of that will get posted on the website as soon as we can. So we'll post a presentation from tonight sooner rather than later, but then we'll add all the additional questions that come from the meeting tonight onto our website. So families that can attend can still have those answers, because it's likely that someone else would have asked that same question tonight. So we want to make sure we give a lot of opportunity for input and to keep answering those questions. This is an ongoing discussion, and we understand the term social emotional learning. While we've been using this a lot in our district, and schools have now for quite some time, and we've been doing it for years under some other names, that there's a lot going on in the news, and we want to be very specific about what Center Grove is going to do and how we're going to stick with the state mandated employability skills. So this is very much to talk about what Center Grove's position is and how we're going to move forward and what we want to do to help students have their affective needs met so that they can achieve their academic potential.
Yes, thank you, Nora. It's going to be a good evening. Again, a lot of opportunity for feedback from parents, questions. So they've done a lot of work. I think there's now up to about 50 plus questions and getting addressed there tomorrow or tonight. So it's 6:30 at the Innovation Center. I encourage you to come out if you have time to hear the information and to provide feedback. Are there any specific questions regarding that, Stacy? No? Okay. I think there was, before I end for us, I think there was an additional question about would we be doing a survey since the mask situation, since now that we're not requiring masks, and looking at doing an opportunity to go back to a virtual environment. So the short answer to that is no. We're not in the position to provide a virtual program like we did last year at this point in the year. We will, if we have to, we'll be looking at a virtual program just to address issues as a whole school corporation, but we will not be setting up a separate option for virtual school run parallel like we did last year. So, Nora, you want to add anything to that, or does that pretty much cover what you said?
Yes, I think if safety necessitates, we would do e-learning options, but we wouldn't be opening up a virtual only school.
Correct. Yes. And so I know for some folks that that might be a little bit frustrating, and we're sorry that we're not able to manage both those systems this year as we continue to work towards getting everyone back in school for an in-person learning as much as possible. But it became quite expensive for the school corporation and for the community to try and run the split program. And then it's costly and very logistically challenging to have folks come in and out of a virtual program. And of course, the state isn't fully funding the program, which really impacts the ability to be able to run something at full force. So we wish we could do more in that realm, but unfortunately, funding is a big piece of that. Our back to school information is on the website at centergrove.k12.in.us/back to school. Thursday, August 5th is the first day for students. So teachers will be starting earlier. I think it's August 2nd. And students coming on that Thursday will get a couple of days in. Students and staff like that, maybe 1 or 2 days get start, and then you have the weekend to kind of get ready to hit it full force for a full week. Any other questions, Stacy, that we need to look at? Okay, any general questions at all? No? Okay. All right, I believe that's our last slide for this morning. I want to thank everyone very much for attending. And again, you have additional questions, and it can be about anything, not just what we presented, but anything else. Please feel free to reach out to us, and you can contact any of us on the screen, and of course your principals as well. So with that, I want to thank you all. I hope you have a wonderful rest of your summer, and we will see you soon. Thank you.